In this video, we're going to talk about neurotransmitters. This is a list of them that you should know for AP Psychology. So first we have acetylcholine. Acetylcholine is involved in voluntary muscle contraction. It is also involved in learning and memory. If a person has excess acetylcholine or too much acetylcholine, then that's going to cause convulsions. And if they have a deficit of acetylcholine, or if they do not have enough of it, then that leads to Alzheimer's disease and also paralysis. An agonist of acetylcholine, which would be a drug that mimics the action or reinforces the action of acetylcholine. And an agonist would be nicotine, and an antagonist, which would be a drug that opposes the action, would be botulinum. And the thing you could use to remember this is acetylcholine starts with A, and so does Alzheimer's. Next, we have dopamine. Dopamine is involved in movement and attention and alertness. It is also related to reward and could be involved in addiction. Excess of dopamine causes schizophrenia, and deficit of dopamine causes Parkinson's disease. And agonists of dopamine are Adderall, cocaine, amphetamines, and L-Dopa. Antagonists, we would have antipsychotics, and an example of that would be thorazine. Next, let's talk about GABA, which is an acronym. GABA is the major inhibitory neurotransmitter. What it does is that it depresses or slows down the nervous system. An excess of GABA would cause sleepiness, poor coordination, and lower social inhibition. Now, that doesn't necessarily mean that the person is going to be introverted. It just means that in a social situation, they're not going to have as many inhibitions, or they're not going to stop themselves from doing something crazy. A deficit of GABA would cause anxiety disorders, insomnia, which is difficulty staying or falling asleep. An agonist of GABA would be alcohol, and the thing on the bottom I drew was a chemical formula of alcohol. You don't have to memorize that. Antagonists would be Xanax. Endorphins are neurotransmitters that are involved in pain relief, feelings of pleasure, stress reduction, and they're basically acting like natural opiates, so they're painkillers. A deficit of opiates would be involved with addiction, possibly, because the person is taking a drug that is agonist of endorphins, or in other words, they're taking a drug that does the same thing that endorphins do, so their body stops producing endorphins, and that leads to a deficit of endorphins when the person stops taking the drug, and that's causing addiction. And then an agonist would be morphine, opiates, heroin. Endorphins, which starts with END, end pain. So that's how you could use to remember this. Serotonin is a neurotransmitter that is involved in mood regulation, hunger and appetite, and your sleep circadian rhythm. Excess of serotonin would cause hallucinations, and a deficit of serotonin would cause depression. An agonist would be psychotics, ecstasy, Zoloft, and SSRIs. SSRIs means selective serotonin reuptake inhibitor, which means that every time in a synapse serotonin is released, less of it is going to be absorbed back. So more serotonin goes through the synapse. Serotonin, the TON, serotonin regulates tone and mood, so you could use that to remember serotonin. Epinephrine and norepinephrine are adrenalins. They produce a fight or flight response. They increase the heart rate, increase circulation, increase respiration, and they increase mental arousal and alertness. These are things that you'd expect a person to have when they are stressed. And next, let's talk about glutamate. Glutamate has an excitatory effect on axons, and it is also involved in memory formation. An excess of glutamate would lead to migraines and seizures, and an agonist of glutamate is acid in shellfish. I don't know why the A is gone. There. Now, the thing you could use to remember this is that glutes are exciting and glutamate is excitatory.